also follow us on Twitter at GP Notebook for more information about new podcast episodes and study groups, and you can find me on there too at Roger the Doctor. Finally, you can visit gpnotebook.com for podcast. I'm going to be discussing ovarian cancer, and this was requested by one of our GP listeners, so thank you very much indeed for that. And we thought it was an excellent topic to look at, because ovarian cancer is the 5th most common malignancy in the UK in females, accounting for just over 4,000 deaths per year, with about 5,000 new cases annually. As we look at a frequency of new patients per GP, that works out at about 1 in every 5 years, but as we all know, it can certainly happen more frequently than that, just depending on statistics. And if we look at all genital tract cancer, then ovarian carcinoma accounts for about a quarter of that, but is responsible for more than half the deaths. And this, as we know, is mainly because of its late presentation. Usually occurs between the 3rd and 8th decades, but has a mean age of incidence of just under 60. Now, one of the reasons why we should be concerned about ovarian cancer, because the outcome is generally poor. If you look at an overall 5-year survival rate, this is usually around less than about 35%. But despite this, there's been a 2-fold increase in survival over the last 30 years, and this is primarily being driven by the advent of effective chemotherapy, particularly the introduction of platinum-based agents in particular. Now, there is unfortunately no screening method available yet that has been shown to affect mortality in any significant way. And the UK Collaborative Trial of Ovarian Cancer Screening reported in 2023, and they concluded that screening using the CA125 blood test or ultrasound scans to test for ovarian cancer did not save lives and was potentially associated with some harm. And so at the moment, an ovarian cancer screening program for most women can't be recommended. That may change with time, but at the moment that is why we have no national screening program. Now, NICE guidance has emphasized the importance of us as clinicians being aware of the symptoms and signs of possible ovarian cancer, and they suggest we should refer any woman urgently if physical examination identifies ascites or a pelvic or an abdominal mass which isn't obviously uterine fibroids. They should also carry out tests in primary care if a woman, especially if age 50 or over, report having specific symptoms on a persistent or frequent basis, particularly more than 12 times per month. And they mention persistent abdominal distension, loss of appetite or early satiety, pelvic or abdominal pain, and increased urgency and or frequency. And they also say we should carry out tests in primary care if a woman reports unexplained weight loss, fatigue, or changes in their bowel habit. They should also carry out appropriate tests for ovarian cancer in any woman of 50 or over who's experienced symptoms within the last 12 months that suggests irritable bowel syndrome, because IBS rarely presents for the first time in women of this age. I think that's an important point to make. According to the 2016 version of Target Ovarian Cancer's Pathfinder report, 21% of women aged over 50 years who had been diagnosed with ovarian cancer were told that they may have IBS when they initially presented to their GP with symptoms. Now, in younger women, a thorough history may often help to distinguish between irritable bowel and ovarian cancer as a cause for bloating, with other symptoms indicating one diagnosis or the other. But as a reminder, bloating related to IBS tends to come and go through the day, be intermittent and related to meals or stress, and be helped by defecation, whereas with ovarian cancer, the bloating tends to be persistent, lasting all day. It can be there on waking, which is an important differentiating sign, and is usually unaffected by defecation. Now, a nice talk about measuring serum CA125s in primary care in women with symptoms that suggest ovarian cancer. And if the CA125 is 35 international units per mil or greater, we should be arranging an ultrasound scan of the abdomen and pelvis. And if the ultrasound suggests ovarian cancer, the woman should be referred urgently for further investigation. And we should be investigating any woman who's got a normal serum CA125 or CA125 of 35 or greater, but a normal ultrasound. We should be assessing her carefully for other clinical causes